Welcome back. As long-term care homes across Ontario deal with new variants of the COVID-19 virus, Toronto Public Health confirming 10 of Ontario's 34 new cases of this variant are from people living in the city. The Ford government has now extended the provincial state of emergency. So a lot to discuss. Dr. Lisa Solomon, an ER doctor with Scarborough Health Network, joins us now to describe what the situation is like on the front lines. Dr. Solomon, good morning.
Good morning, Melanie.
So let's begin first with your experience right now. You're getting up, you're getting ready for your 7 o'clock shift. What does the emergency room look like? What do the front lines look like as it stands?
Yeah, so right now, it's busy with a lot of really high acuity patients. So a lot of really sick patients. We're having lots of people coming in by ambulance, and a lot of those patients who are coming from ambulances who are waiting because our rooms are full. So all of our isolation rooms and areas where we deal with sicker patients are full because our wards have been full, our ICUs have been full. So it's a trickle effect down to the emergency department.
Indeed, this has got to put a personal strain on you as a physician.
You know, it's we do the best that we can do all the time, but it can be difficult when you walk by and you see these patients, you know, in the EMS hallway waiting to be seen, and you know, you're concerned about them and you want to start treatment. And so sometimes just balancing and trying to juggle managing sick patients and trying to figure out where the next patient is going to be put. And, you know, hopefully, you know, patients can be admitted to the ward altogether can put a strain on us for sure.
Dr. Solomon, there's a lot of talk around the strains first detected in the UK. Just how much do we know about them and how concerned should we be?
Yeah, so I think we need to be really concerned about it. We saw what happened in Barrie at Roberta Place, the long-term care, and it spread like wildfire through that home really, really quickly. I mean, we saw some long-term care homes in Toronto where the virus spread fairly quickly, but nothing like that home. I mean, that was unbelievable how fast it spread through the fact that almost 100% of residents and workers got COVID really is quite frightening. We're also now seeing some younger people, like considerably younger people, getting COVID and getting quite sick. And we don't know yet because this is really new. We have no idea if that's this new strain or not. But I think we have to be very careful. I think we have to be really vigilant. You know, there have been some encouragement with our numbers dropping, but now with the climb in numbers of this new strain, you know, I am concerned, and I think people should be very careful.
So as we look to the positive, and that is on the vaccination front, sadly, the supply is not positive right now, but at least we do have the vaccinations there. Do we know more about being able to inoculate younger people just yet? I know the trials are currently underway, and there's a lot of discussion around that because if kids are to get back to school, of course, the discussion surrounds the vaccinations for the youngsters.
Yeah, I mean, that's a perfect question. I have 3 children aged 10 to 15. And so I really want to be able to vaccinate my children. I was actually reaching out to some people to say, are we doing any trials in the GTA? Because I would for sure enroll my kids. Trials for both Pfizer and Moderna are currently ongoing, particularly for the age 10 to 16 age groups. And I'm very hopeful that they will be done in the next few months so that we're able to vaccinate our children, because I do think it's really important that they get vaccinated to be able to return to school, to not be carriers for family members. But I also think that they need to expand their studies for younger than 10 as well. So, you know, I'm hopeful. I mean, the vaccine, having the vaccine here is really exciting. I mean, the amount, sort of science now in 2021 is fascinating. The fact that this vaccine came about so quickly is absolutely astounding. And, it's definitely the light at the end of the tunnel for sure.
Indeed. Let's just get them here. Dr. Lisa Solomon, appreciate your time. Thank you.
Thanks for having me.
6:22 is your time right now. Still to come here on Breakfast Television, we're going to give you a look at the latest in COVID-19, including details on a couple accused of vaccine line hopping. We're going to tell you who they are and why it's costing them their jobs. That's next.